Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 23rd, 2020. I'd like to bring you said information pertaining to this, the pandemic, circulating the globe here stateside. That is COVID-19. The said information is brought to you by Washington Post. It is a lengthy article, so bear with me, but I'm bringing you this information because I feel people need to know the severity of this disease and the complications and the ramifications of this deadly virus. A mysterious blood-clotting complication is killing coronavirus patients. Craig Cooper-Smith was up early that morning as usual and typed his daily inquiry in his phone. "Good morning, Team COVID," he wrote, asking for updates from ICU team leaders working across 10 hospitals in the Emory University Health System in Atlanta. One doctor replied that one of his patients had a strange blood problem. Despite being put on anticoagulants, the patient was still developing clots. A second said she'd seen something similar, and a third. Soon, every person on the text chat had reported the same thing. "That's when we knew we had a huge problem," said Cooper-Smith, a critical care surgeon. As he checked with his counterparts at other medical centers, he became increasingly alarmed. It was as many as 20, 30, or 40% of their patients. 1 month ago, when the country went into lockdown to prepare for the first wave of coronavirus cases, many doctors felt confident they knew what they were dealing with. Based on early reports, COVID-19 appeared to be standard variety respiratory virus, albeit a contagious and lethal one with no vaccine and no treatment. They've since seen now COVID-19 attacks not only the lungs, but also the kidneys, the heart, intestines, liver, and brain. Increasingly, doctors also are reporting bizarre, unsettling cases that don't seem to follow any of the textbooks they've trained on. They describe patients with startlingly low oxygen levels, so low that would normally be unconscious or near death, talking and swiping on their phones. Asymptomatic pregnant women, suddenly in cardiac arrest. Patients who, by all conventional measures, seem to have mild disease deteriorating within minutes and dying at home. With no clear patterns in terms of age or chronic conditions, some scientists hypothesize that at least some of these abnormalities may be explained by several changes in patients' blood. The concern is so acute, some doctor groups have raised the controversial possibility of giving preventive blood thinners to everyone with COVID-19, even those well enough to endure their illness at home. Blood clots, in which the red liquid turns gel-like, appear to be the opposite of what occurs in Ebola, Dengue, Lassa, and other hemorrhagic fevers that lead to uncontrolled bleeding, but they actually are part of the same phenomenon and can have similarly devastating consequences. Autopsies have shown some people's lungs filled with hundreds of microclots. Errant blood clots of a larger size can break off and travel to the brain or heart, causing a stroke or heart attack. On Saturday, Broadway actor Nick Cordero, 41, had his right leg amputated after being infected with the novel coronavirus and suffering from clots that blocked blood from getting to his toes. Lewis Kaplan, a University of Pennsylvania physician and head of the Society of Critical Care Medicine, said every year, doctors treat people with clotting complications, from those with cancer to victims to severe trauma, and they don't clot like this. The problem we are having is that while we understand that there is a clot, we don't yet understand why there is a clot, Kaplan said. We don't know, and therefore we are scared. The first sign something was going haywire was in legs, which were turning blue and swelling. Even patients on blood thinners in ICU were developing clots, which is not unusual in 1 or 2 patients in one unit, but it is for so many at the same time. Next came the clogging of the dialysis machines, which filter impurities in blood when kidneys are failing and jammed several times a day. There was a universal understanding that this was different, Cooper-Smith said. Then came the autopsies. When they opened up some deceased patients' lungs, they expected to find evidence of pneumonia and damage to tiny air sacs that exchange oxygen and carbon dioxide between the lungs and the bloodstream. Instead, they found tiny clots all over. Zoom meetings were convened in some of the largest medical centers nationwide: Tufts, Yale New Haven, the University of Pennsylvania, Brigham and Women's, Columbia Presbyterian. Theories were shared, treatments debated. Although there was no consensus on the biology of why this was happening and what could be done with it, many came to believe the clots might be responsible for a significant share of U.S. deaths from COVID-19, possibly explaining why so many people are dying at home. In hindsight, there were hints blood problems had been an issue in China and Italy as well, but it was more of a footnote in studies and on information sharing calls that had focused on the disease destruction of the lungs. It crept up on us. We weren't hearing a tremendous amount about this internationally, said Greg Piazza, a cardiovascular specialist at Brigham and Women's, who has begun a study of bleeding complications of COVID-19. Helen V. Boucher, an infectious disease specialist at Tufts Medical Center, said there's no reason to think anything is different about the virus in the United States. More likely, she said, the problem was more obvious to American doctors because of the unique demographics of U.S. patients, including large percentages with heart disease and obesity that make them more vulnerable to the ravages of blood clots. She also noticed small but important differences in the monitoring and treatment of patients in ICUs in this country that would make clots easier to detect. Part of this is by virtue of the fact that we have such incredible intensive care facilities, she said. The body's cardiovascular system often is described as a network of one-way streets that connect the heart to other organs. Blood is the transport system responsible for moving nutrients to the cells and waste away from them. A common cold or a cut in the finger can lead to changes that help repair the damage, but when the body undergoes a more significant trauma, the blood can overreact, leading to an imbalance that can cause excessive clots or bleeding, and sometimes both. Scientists call this hemostatic derangement. In math, a derangement is permutation in which no element is in its original position. Harlan Krumholz, a cardiac specialist at the Yale New Haven Hospital Center, said no one knows whether blood complications are a result of a direct assault on blood vessels or a hyperactive inflammatory response to the virus by the patient's immune system. One of the theories is that once the body is so engaged in a fight against an invader, the body starts consuming the clotting factors, which can result in either blood clots or bleeding. In Ebola, the balance was more toward bleeding. In COVID-19, it's more blood clots, he said. A study published in JAMA on Wednesday found that a large number of COVID-19 patients admitted to New York State's largest health system came in with blood test readings that indicated clotting problems. And a Dutch study published April 10th in the Journal of Thrombosis Research provided more evidence the issue is widespread, finding 38% of 184 COVID-19 patients in an intensive care unit had blood that clotted abnormally. The researchers called it a conservative estimation because many of the patients were still hospitalized and at risk of further complications. Early data from China on a sample of 183 patients showed more than 70% of patients who died of COVID-19 had small clots developed through their bloodstream. Although acute respiratory distress syndrome still appears to be the leading cause of death in COVID-19 patients, blood complications are not far behind, and Binood Bigdeli, a fourth-year fellow at Columbia University Irving Medical Center, who's helped anchor a paper about the blood clots in the Journal of the American College of Cardiology. My guess is it's one of the top 3 causes of demise and deterioration in COVID-19 patients, he said. That recognition is prompting many hospitals to change the way they think about the disease and manage it. When the novel coronavirus first hit, the Centers of Disease Control had prevention and others put people with asthma at the top of their list of those who might be the most vulnerable. But European researchers writing in the journal Lancet noted it was striking how underrepresented asthma patients had been. Earlier this month, when New York State released data about the top chronic health problems of those who died of COVID-19, asthma was not among them. Instead, they were almost all cardiovascular conditions. Some medical centers have begun giving all hospitalized COVID-19 patients, small doses of blood thinners as preventive measures, and many are adjusting doses upward for the most seriously ill. The challenge is the more you give, the greater the danger of upsetting the balance of the other direction and having the patient bleed to death. Another big mystery the doctors hope the blood issue will shed light on is why some maternity patients are collapsing during or after giving birth. A paper published in the American Journal of Obstetrics and Gynecology, MFM, in late March detailed how 2 women with no prior symptoms of COVID-19 ended up in intensive care. The first was a 38-year-old patient of New York Presbyterian Columbia University Irving Medical Center in Manhattan who spiked a fever of 101.3 while undergoing a C-section delivery and began bleeding profusely. The second woman, 33, also underwent C-section, but the next day developed a cough that progressed to respiratory distress. Her heart beat irregularly, and her blood pressure jumped as high as 200/90. Several physician researchers said the relationship between COVID-19 clotting and pregnant women is an area of interest. Women in childbirth can experience clotting and bleeding complications because of involvement of the blood-rich placenta, but it's possible COVID-19 may be triggering additional cases by making some women's bodies lose balance. There's a lot of speculation, Croman said. That's one of the frustrating things about the virus. We're in a lot of darkness still. That was a very lengthy article. Sorry it was so long. This is by the Washington Post. But as you see, sinuses, sorry about that. The COVID-19 virus is affecting the blood. Blood clotting, failure of the kidneys, heart, kidneys, and the brain. The African-American child who passed away recently in Detroit, Michigan, had complained of a headache to her parents. So as you see, that was one of the downfalls of this virus that affected that young child, that those headaches led to her having a brain issue. Because if I'm not mistaken, I believe she was in a coma or brain dead. So as you see, COVID-19 affects all parts of the body. Asthma was believed to be an issue at one point. Thought most patients had asthma would be in dire straits pertaining to this, would be one of the main symptoms. But now you see it's not asthma. Then it was a certain age group. Remember, that was the first thing we heard, 60, 65. Now you're seeing different age groups. Then it was underlying conditions. Now we're finding out 5-year-olds, 10-month-old babies, 14-year-olds have the disease. Chris Cuomo, many of you know him as a news anchor. He had the virus. His wife also had the virus. And now we find out his son, his teenage son, has the virus. So obviously the son contracted the disease from the parents. So as you see, it does not matter who you are, your demographic, or your age, or having an underlying condition. I brought you this information so you can be aware of the complications of COVID-19 and to know the signs and the symptoms of this virus, and to know that besides it being a respiratory disease affecting your lungs, it also affects your kidneys. It also causes blood clots. It also affects your heart. It also affects your brain. No one is immune to COVID-19, obviously. And this is the thing about a disease. You really will not know who and what, where, and why until you gather data from those infected and from autopsies, which is common sense. I'm praying for America and those abroad. I'm praying for all those short, tall, fat, skinny, white, black, Asian. No matter who you are, where you are, you can contract this disease. And as I stated to you all last night in a video, I know of 2 people here locally where I live who have the disease. It has been revealed. And I'm praying for those 2 people and their family. I'm praying that none of us contract this disease, because we're in a small demopolis and it would take nothing for it to spread, because people are still running around, going in and out of people's homes, cars, sitting out with them, outside without mask on, going in their homes without a mask. We've all made the mistake, some of us anyway, talking to people without a mask still inside their homes or outside, not being 6 to 13 feet away from them. We are all susceptible to contracting COVID-19. And some people do not consider this disease deadly. Some do not believe the hype. Some do not believe the stats. Some believe there are other ulterior motives behind the disease, man-made, planted, whichsoever. You are entitled to believe whatever you want to believe. But I tend to believe in those who are no longer living. I tend to believe those who are currently ill and sick. I believe those who have contracted the disease and are still alive to testify that they survived COVID-19. That is the proof I need. And as I state, to bicker about the origin and where it came from, we're past that stage. It is here, and there's nothing we can do about it but try to find a cure and to combat the disease and stay safe. To stay safe. What will become of the U.S. and abroad? How will people be able to work? Because I don't think people are really realizing the stigma of saying, go back to work, go back to this, go back to that. There are people who have jobs where they cannot wear a mask all day. They cannot conduct business with a mask on. They will not be able to talk, answer a phone, dissect, decipher, give said information with the mask on. So to say 6 feet, 13 feet from someone is illogical in a group setting, in a work setting with many people walking about on a floor in a business office. It's not conducive. And it's idiotic, quite frankly. I always tell people, sometimes you need to think before you speak. And naturally, we need to get back to work. Get back. But you can't make something be that it ain't. Like, share, subscribe, drop your comments below. Thanks for joining me. God bless you all. Thanks for hanging in there, watching, listening. I appreciate the comments. You all have been so kind to me this week and in the past. And I just want to thank you. I want to thank my new subscribers, those who just tuning in, dropping by. Everyday Shenanigans. God bless you and thank you so much. Thank you so very much. I am humbled. I am very humbled. And I just want to thank you. Please stay safe, America and abroad. Wash your hands, keep up your hygiene, put all masks and gloves in the appropriate receptacles, and stay safe. This is Everyday Shenanigans. Bye-bye.